Inga mana, inga reo, inga iwi, tēnā koutou katoa. Ko toku pepehe tēnei. Ko Waikato, Waikato te awa, ko tainui te waka, ko taupori te moanga. Ko rorongi te hoa kora, ko horiwaka na tupuna. Ko rokawa te kotemana na iwi, ko Ngāti Tukarehi te hapu, ko tāpapa te marae, ko ron tōku ingoa. Tēnā koutou, tēnā koutou, tēnā koutou katoa. It's wonderful to be here today. It's such a privilege to be in this place and to be with you. And I have to say it was a great privilege to listen to Helen just then. And it took me back to thinking in 1989 when Peter Davis was putting together a book and asked me if I would write the chapter on how New Zealand law had responded at that point to the HIV and AIDS epidemic. And I called it Softly, Softly, New Zealand Law Responds. And so our inquiry has started rather softly. Well, actually, it started with the Prime Minister announcing it on the last day of January. And we're here this morning to introduce ourselves, to introduce the inquiry, and actually to talk about how we're going to learn from you about, in the addictions area, about the work that we need to do, what's the evidence of what's working, and what recommendations shall we come up with. So we're going to have just a little bit of an introduction. I'll just introduce now with photos the members of the panel, one of whom the Minister David Clark omitted to mention, and that is Professor Sir Mason Jury. So as you can see, we span a wide range. There's never been an inquiry panel quite like this in New Zealand. I was interested to read back, people debate about the role of inquiries, and Warwick Brunton at Otago University has done some research on this, and he's looked at the 6, I think, over about 150 years, inquiries into mental health that have been held. And I was intrigued to see that the last two, one, Jenny Shipley, of course, the inquiry that was headed by Judge Ken Mason in the early 1990s. And I must say, someone I know well because he lived next door to Mum and Dad for many years, and he's a friend, so they looked over the fence. So there was that inquiry, and then before that, Prime Minister Keith Holyoake, who called an inquiry, and at a meeting with the PSA, where no one was supposed to take notes, apparently said, I don't want a psychiatrist heading it, I want a layperson. So they have a layperson this time, but they also have an inquiry panel that spans the ages of 79 to 22. And I tell you, you've got to spend some time with Josiah and bottle that energy. And you're going to hear from two. We can't all be here, but you'll hear from two of the panel members in a moment. But we're largely a brown panel. We span a lot of ages and experience. So I'm going to ask my colleague Barbara Disley to come up now and just talk a little bit about the scope of the inquiry. Barbara.
Kia ora, thanks, Ron. E ngā iwi, e ngā reo, e ngā mana, tēnā koutou katoa. Ko Kosciuszko te manga, ko Tumut te awa, ko te whenua te moimoia te whenua, ko te motu o Waiheke te tūranga waiwai. Ko Barbara Disley tuku whenua, nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. So kia ora everybody, it's a real privilege to be here, and I do come from the land of the dreaming across the water, but I've now been here 38 years, so please see me as a Kiwi, not as an Aussie. My children have grown up here, and this is my Turenga Waiwai. So, and I have had quite a bit to do with the mental health and addiction space over the years. So it's a real privilege, as Ron said, to be in the position working with him and the other panel members to really be able to take, at this point in time, a really clear, focused, broadly based approach to looking at what are the issues, what's working well, where are the gaps, and please, please, what are the solutions and the innovations and the ways that we could think differently about this space. Because I can assure you, our inquiry brief is very broad. Probably for the first time, it's been flagged that we can take a broad social context look at what is happening in this area and what are some of the factors that may be implicated in continuing the flow. So we really want people to think about what might stem the tide, what might we be able to do differently earlier, what is the societal context, as the Minister and Helen have talked about, and it's just now a real opportunity to take a broader public health approach, health promotion, illness prevention, and then what do we do well when there are challenges. So that's what we've been charged with. And we're going to do all that in the next 7.5 months. We're not sitting terrified in our beds about the enormity of it, but anyway, we won't go there. So, hopefully that'll move, yep. So our challenge is to identify unmet need related to both mental health and addictions across the span, and to develop recommendations for a really cohesive mental health and addiction framework going forward. We are going to do that in a way where we are already, we hope, as part of the process, starting to move people forward. It's about building connections. It's about not having something stop while you wait for the real answer. It's about keeping things going. It's about engaging. It's about connecting. And it is about, together collectively, beginning to formulate new ways of thinking, new ways of being, and seeing where that takes us. We are looking for some fresh thinking, and you heard the Minister this morning say that. He has also told us to be courageous. And I don't think you should tell those 6 people who are up there on the list before to be courageous unless you really want to hear some different things from the things that you've heard in the past. And I really, Helen, valued your commentary this morning because I think it flags the way in many directions for us, because I don't believe, even at this very early stages of the panel, that we can actually go forward without taking a deep, deep look at as a society in Aotearoa in terms of what do we deeply, deeply value, and where do we put our money, and where do we really show and reflect what we deeply, deeply value. So our approach will be to be open and inclusive. There is nothing that we can't hear. We mightn't agree with everything, but we are going to go out and seek and engage with everybody. There will be people who'd like to go back to the future and do a bit of a lock-em-up thing, and we will hear all of that. And we want to hear that because we have to know where we're starting in order to know where we need to go. We'll be building on the knowledge that's already done. There have been numerous reports, some really good work, some really good strategies developed. We're not going to redo all of that, but we are currently sifting all of that and starting to get all of those cameos together, and we'll be focused on solutions, and that's critical. So I hope you'll join us on our journey, and I'll hand over to my dear colleague Dean, who's going to talk about our values and what's driving us at the moment. So kia ora, Dean.
Well, I just want to start off as the bee's knees being in Parliament. So I thought I'd sort of take the chance to acknowledge that and to acknowledge the enormity and magnitude of what's ahead for the inquiry panel. And, you know, I felt that weight but I also want to signal that also the inquiry panel members too. And you talk about consumer inclusion. It's a natural process for the inquiry panel, and I think that signals the importance of having the consumer voice. So it's my honour and privilege to have my whānau here today. Nō reira, he mihi nui kia koutou, ki ngā pau, ki ngā rangatira ko taimai ki te haramai ki tēnei hui nā. Tēnā koe te rangatira, kau Matua text Tiffany Clark. Me Matua kiri opai. Me te whānau no te tai rāwhiti Tiri Huriwai. And would not be right without also acknowledging Tuari Pōtiki and me tōna hoa rangatira Tracy, for whom I met in the 80s when Tirito Arahi was around. And so I mihi kia korua. I also mihi to Matua Raki's Consumer Leadership Group, and they allowed me to come to their space and place. And straight away, they are leaders in addiction. They are the voices that we should be listening to. And that what is alarming is that the peer support that's required for addictions, that's a specific skill that's required, particularly within mental health inpatient services. And I'm going to say this, and it might irk some people, but in the paper the other day, 6 of my colleagues, my friends, were assaulted at Canterbury District Health, and that was through a process where someone was withdrawing from P. How do I describe P? He nangara nui. It's a big taniwha, and that we must examine the withdrawal process for them, and I guess the right fit with regards to working with people who are withdrawing from addictions, particularly within the mental health system. And I've been given the honour and privilege to actually talk about our values and tu manako pai, for we are saved by hope. And without hope, it kills one's recovery. It aligns with the Salvation Army's quote, "We work to bring hope to New Zealanders that is in need, but we can't do it alone." Ko tahitanga, together as one. There's no I and we. Inclusion of consumer and addiction voices is critical and crucial for better outcomes. Whakamana, meaning to empower and uplift those silent voices to speak. It's good and fine that some of us have the ability to come to the forefront, to be able to talk, to be able to communicate, but what about those silent voices? How do we reach out to them? And for whanaungatanga, to ensure we hear the voices of the mental health and addiction consumers, and more importantly, their whānau and families, and the communities of support services. And aroha, that we put the people at the heart of all what we do. We work from a place of openness and transparency, empathy and thoughtfulness. And that one of the teaching points that I got from Matua Raki's Consumer Leadership Group was it needs to be addiction-centric. Let them work with our people who suffer mental distress through addiction. Nō reira koutou mā, i ako rau rangatira, a tēnā koutou, tēnā tātou katoa.
So how are we going to do all this by October? That's a busy-looking slide. It basically says we're coming to a place near you. So Next month we'll put out a pretty brief consultation document in which we'll ask you what's working, what's not working, and how can we improve. We're going to organise our visits around the country through the districts, through the regions, district health boards, and we'll be looking when we make those, go for those meetings for a day or two that meet both with people working in services, but meeting with community organisations, with consumers and so forth. But we will, of course, also be meeting groups in the sector, such as today's meeting. And critically, yes, we'll want to meet with you, we'll want to meet with consumers, but we'll also be looking for you to make a submission through your individual organisations. We know many individuals will want to tell their own stories. We're asked by the government to do three things. One, to hear the voices of the community. Two, to develop an evidence base, and we've commissioned the Element Research Group under Ruth Cunningham at Otago University, but here at the Wellington School of Medicine, to be doing that, because we can't wait till we've had the hearings process. This is not the confidential forum with 2 or 3 years to do it. We've got to be doing that at the same time as we're gathering the evidence here and internationally, and then come up with some recommendations, This is a once-in-a-generation opportunity, and we want to have a message of hope, but we also want to have some fresh thinking, some broad thinking as we do that. And we've got an email address there. I mentioned Ken Mason. I went to see Ken at his home, and he's now moved to the Nelson Marlborough area, and I went and sat with him at his home in Richmond, and well, actually, as he opened the door, I sent him a text, said, could we have a cup of tea? He said, Ron, they're asking you to lead an inquiry, aren't they? He was onto it. And so we sat for a couple of hours, and he's actually coming to meet with us in Christchurch as a full panel next Wednesday, and I said, so Ken, what's your advice? He said, Ron, master and servant. Well, that's a bit cryptic. Could you just elaborate a little bit, Ken? He said, don't go as a judge. Don't go up there sitting on high as the master. Go as the servant. The people are the master. They will provide the answers. And I just want to close with something that I learned at our first panel meeting. We spent a lot of time, just getting to know each other. We were strangers. And Dean talked about aroha, and he talked about hope, and he talked about whanangatanga. And he used this word, and he the word was mai, and he was sort of touching his heart. And I said to him at the break, what's mai? And it's the pain in your heart. And I can say, and I suspect many in this room can say, if you know what that pain is, if you've seen addiction in your family through generations, then we know about pain, and you know about hope, and you know about some of the solutions that you're going to share with us. Some that you'll be working on today, and some that you'll tell us when we meet with you. So, hei waka eka noa, we're all in this together. Tēnā koutou, tēnā koutou, tēnā koutou katoa.